We're back on the Urology Care podcast. Today we're going to be talking about testicular pain 101, and I'll open the discussion by having our guest today introduce herself.
Hi, my name is Suzanne Kwolek. I'm a nurse practitioner who specializes in andrology at University of Michigan. I have specialized in taking care of men's urologic issues for almost 20 years. And most recently, I've moved into focusing more on chronic genital and testicular pain.
So what causes testicular pain?
That's a great question. The easy answer sometimes is an infection. We certainly see this in a lot of students with sexually transmitted infections and adults as well. Trauma is another good answer. Again, a lot of folks playing sports and taking blows to their genitals. Sometimes it can manifest post-vasectomy, and this can be a couple of months post-vasectomy, or it can be sudden onset 20 years post-vasectomy. And lastly, I would say that certainly there is a role for spontaneous or neurologic-related testicular pain, which can be the most complex to sort out.
How common is testicular pain?
Well, that's a difficult question. Again, if you look at relatively easy causes to identify, things like infections, the incidence is out there. I don't know that anyone's ever really calculated it. Post-vasectomy, testicular pain can be somewhere between 1% to 2% of men who have vasectomies. Beyond that, for some of the other causes that I've mentioned, we really don't know. Sometimes it gets rolled into male pelvic pain, and so it doesn't get sorted and coded individually, so it's hard for us to track.
Is there any link between testicular pain and testicular cancer?
Yes, there definitely is. Sometimes testicle pain is the driver of men seeking care for pain for an evaluation for testicular pain. It can sometimes be the first indicator that there's an issue that needs to be evaluated. The fortunate part about that is that it's very easy to identify with a scrotal ultrasound. And so our policy is that if you have testicular pain for longer than a few days, we generally get a testicular ultrasound.
When would you recommend patients seek care for having testicular pain?
If their testicular pain is a sudden onset and very, 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 very painful, very, very acutely painful, they really need to go to the emergency room. And I know that's not popular with everybody because of access issues and copay issues, but it is really important with sudden, very severe testicular pain to get that evaluated very quickly. If it's a more gradual onset but severe, they could probably seek care or at an urgent care, or try and get a same day or next day appointment with their primary care or with a urologist. And if it's mild pain, sort of headache level pain, if you will, they can get care on their schedule, especially if it's been chronic and they've had pain for quite some time.
How is testicular pain treated?
It really very much depends on the cause, as you might imagine. If we determine that there's an infectious cause, we prescribe appropriate antibiotics. If there's a trauma cause, we'll do whatever is required in that domain, surgery or whatever. And if it is this kind of chronic neurologic pain, it's a lot more difficult to sort out, and take some time to figure out what's going to be the best plan for that individual man at that time.
Is it possible that testicular pain will just go away on its own?
Sure. And pain is an interesting creature because some people have different impressions of pain and different tolerances of pain. And if pain, we all get headaches, for instance, and you can have similar episodes of non-threatening aches and pains in other parts of your body, including the testicles. I mean, hopefully we've all had that experience where we work out and get very, very sore, and we all know that goes away eventually. So it can go away on its own. Sometimes it needs a little help from us in terms of antibiotics or anti-inflammatories or whatever.
What advice might you have for a patient who is suffering with testicular pain?
If it's testicular pain that's been going on for a relatively long time, and by that I mean persistently, probably more than 3 months, I would try and get into a urologist and just be sure, because the key in that evaluation is to get that ultrasound and just make sure there's nothing bad going on inside the testicle. We could do a really thorough physical exam, but we still can't feel the inside of your testicle. So the ultrasound's really key in this evaluation. And beyond that, if the pain's been going on for a long time, say, many months or a couple of years, it's worth it to try and find someone in your area who maybe specializes or has an interest in this sort of pain from a urology standpoint, because there are some really great interventions that we have to offer that don't require surgery, and men are usually happy to hear they don't need surgery on their genitals.
Are there any infertility issues that might come up with being linked to testicular pain?
In terms of infertility issues, varicoceles can cause pain for men. The statistics on that are somewhere between 15 and 20% of men have varicoceles, but of that 15 to 20%, it's a very small percentage that actually have pain from their varicoceles. And so there can be a link between persistent testicular and groin pain and the potential for a male fertility evaluation being helpful.
Can you tell us more about varicoceles?
So varicoceles are, how I always counsel my patients is they're like varicose veins in your scrotum. Patients didn't do anything. They didn't not do anything to provoke it. It's their individual anatomy. And the thinking is that these varicoceles have some influence on testosterone production if they're big enough, and sperm development. They just change that environment within the testicle in which sperm develop. And this can cause the sperm overall to be less robust, less mobile, and just not develop in the appropriate shape, contributing to male factor infertility.
Do you have any other final thoughts before we end today's interview?
Testicular pain is always worth at least a single evaluation, if not with primary care, with a urologist. And just because there is always a risk that there could be something going on, like a tumor. That's really what we want to find out. And it's very easy to sort out with a scrotal ultrasound and a good physical exam. Most urology practices will allow self-referral, and self-referral for testicular pain is certainly a lot of the patients that I see. So it's a very welcome exam. It's a very welcome visit in my clinic, because if there's nothing wrong, I like to be able to reassure patients that they're basically experiencing similar to a headache or a muscle strain, just in their testicle.
Can you just remind folks who you are and one more time before we close out here?
My name is Suzanne Kwolek. I have been a nurse practitioner since 1996. Most of that time, all of that time actually, is spent caring for men, and most of it in urology. And I work at University of Michigan and Michigan Medicine.
This podcast has been brought to you by the Urology Care Foundation, the official foundation of the American Urological Association. For more information on today's topic and for all things urology health, visit urologyhealth.org. That's urologyhealth.org.